viewers, Eco Alt blog is reporting live at Oniru, Lekki Phase 1, Lagos State, on the occasion of the visit of Honorable Minister of State for Health and Social Welfare, Dr. Tunji Alausa, at Diamed Center. Diamed Center focused on bringing advanced medical facilities to Lagosians and the country at large. Therefore, Eco Alt blog will bring to you live footage of this event as it unfolds. I am Taiwo Idowu, reporting for Eco Alt blog.
The Nigeria medical sector is one of the major public sectors affected by massive brain drain due to the poor state of most medical facilities across the country, leading to poor healthcare services as well as lack of experienced medical professionals, which leaves the country's state of health in a dire situation. Therefore, changing this narrative is one of the major agenda of the President Tinubu-led Renewed Hope administration, which is currently being spearheaded by the Honorable Minister of State for Health and Social Welfare, Dr. Tunji Alausa. The Honorable Minister of State for Health and Social Welfare, Dr. Tunji Alausa, paid an official visit to Diamed Center Limited, a newly commissioned medical center situated in Oniru, Lekki Phase 1, Lagos Island, Lagos State, for an official facility check and tour visit in a bid to ensure quality assurance services in the organization. On Tuesday, the 2nd of October 2024. Diamed Center Limited was officially commissioned and launched in July 2024 by the First Lady of the Federal Republic of Nigeria, Senator Oluremi Tinubu. The medical facility has numerous state-of-the-art medical equipment offering a wide range of diagnostic services such as radiology, pathology, cancer dialysis, among many others. Honorable Minister Dr. Tunji Alausa, in a bid to further put words to action in terms of fostering and trailblazing a new trend of medical advancement across the country as the core agenda of President Bola Ahmed Tinubu's administration, paid an official visit to Diamed Center Limited. The minister arrived at exactly 11:45 a.m. as the agenda for the day commenced in full flow.
On behalf of the Diamed staff, I want to warmly welcome Dr. Tunji Alausa to our facility. Let me say, I want to thank you very much. Tunji will represent you, and he did represent you very well. And I like the message, congratulatory message is sent to us. So please help me warmly welcome and clap.
The CEO of Diamed Center Limited, Dr. Abiola Olorode, gave a brief remark about the company's mission and vision in a welcome address.
So please welcome. We set up a small agenda for the brief meeting, and I'll just make some brief remarks. Let me start on existing protocol. It's meant to be formal, looking formal, and I'm not very good at formal, so if I miss some of it. So let me tell you why we have Diamed. I always say that when I was growing up, one of my major stimulus and innovation to do medicine was my youngest brother, Sheldon. Then I don't know whether people that were know Professor Bailey, who was an orthopedic surgeon then. The older generation of men, he had osteomyelitis, and for a long time, that was why we never lost him. Okay. And it's yes.
I read textbook of Bailey, textbook of Bailey. So Bailey. It was in Unilag or UCH.
But he had his own private clinic also. So we started with Bailey. Then we moved to West Middlesex Hospital in UK, formerly ended up in the US. And I always used to tell people that's one of the good things my father was good at, education and health. Do not play with, because the money is spent on reviving it. Some people will say, as soon as I children, why should I waste so much money? So that always got my interest, because my mom's the youngest, he's number 6 and number 2. And I still look back to him, so if he's a big boy now, it towers over me. So that was one of the things that made me go into medicine.
She stressed that Diamed Center Limited aspires to deliver an unwavering, patient-centered, trusted experience.
We believe in dedication, we believe in innovation, multidisciplinary. And those are some of the core values we have. And that's why if you see around the boardroom, that's what we preach. And most staff meetings, I get my staff to recite it, because that's what we believe and that's what we must do. Next slide, please. So, as you see, the ambience, it's safe, it's a comfortable environment. We've tried to segment as we move around. We have a lot of different waiting areas so that we don't have crowd in, and also we want it to be a home away from a home. It's a homely ambience from the decor and the type of furniture we use. So those are some of the things, because we're committed to quality of care that we do give our patients. Next slide, please. So we have a variety of services. We have outpatient. As such, that we have a lot of wellness and comprehensive health care plans. Maybe because we might still in the UN, I feel that we always talk about prevention, public health. So I believe that it's important that people know the health status. So we have laboratory services, radio imaging services from the MRI downwards. We have dental services, we have pharmacy, dialysis, physiotherapy, ophthalmology. So we have quite a comprehensive. And the idea behind that is that you can come into the building. And because I used to hate when I used to do wellness checks, you do blood in one place, you do X-ray in one place, you do mammogram in one place. You can come here and spend the whole day and have everything done, comfortable, and there's under this roof. So the other services we're looking at: endoscopy, food and lab screening services, pre-employment, genetic, premarital screening service, and preschool screening. Next slide, please. I think that's the end of the slide. So those are the sort of services we offer. Based on the services we offer, I know my president is here, and she will support.
She, however, highlighted a number of challenges that is presently affecting the operations of the medical organization.
The one that is on the top of the list, which I spoke to you about, it's killing us. But I have a dedicated line, I have a transformer, I have three what do you call it? Generators, 100, 200 kV, 850. The 850 is 100 liters per hour if I switch it on. This is my last step. When I was trying to do my dedicated line, it cost over 100 million to get that 150 to put that down. So the cost of power is enormous. And everybody that comes to healthcare now tells us, give us discounts. Give us discount. And they know me from my staff, even from me, I pay for my own services. Because I'm a pensioner from UN, so I have them. So when I begin to must be, but everybody wants discount. So it's we are clear and our prayer is that as they are trying to subsidize the public sector, because the private sector do serve a good populace of Nigerians, and we cannot make it prohibitive. And there's nowhere in the world that the public sector private sector only serves public. So this is our biggest key. And that's number one. Number two, I'm very happy the way you've championed the electronic health records for the country. And when we're in UN, UNICEF, one of the major challenges when you go to international is our data. And unfortunately for us is that our data is underreported. And you go to so many international meetings and you hide your face in shame because they're quoting data, but you know it's not right. They cannot defend it. And I think one of the major things is that as we work with the public sector to get the data into a comprehensive data, we need to see how we get the private sector on board. Because a good proportion of the healthcare provision is still from the private sector. And unless you have that comprehensive data, we will always read poorly when you go to meetings. When you go there, everything, It's either here, you see, and all the other countries that are doing poorly had some form of war or some form of natural disaster, and then Nigeria flags up, and then they always call you Nigeria the problem child. They don't say directly. So I think that is when we feel that it will be a good way to bring all the sectors together, both the private. I know you're addressing the issue of the Ajapa syndrome, and that's still a major problem. And I think, but the other thing I feel I tell them is that a lot of the people that have jackpot are not happy. So we're going to see jackpot soon. But they want to come back because there's no condition. I know there's been a bit of provision given the flux on how to manage, then they come back easily. And when we spoke to about the diaspora, they just come back from states there, now to link up with the diaspora in the country. The other last thing I will say, and I'll hand over to my president if she has any ask also, is the health insurance and HMO system. Where do I start? It's always a talk of war between providers and insurances. And since we're mandated, everybody has insurance now, cost of delivering services sometimes outmatches what the HMOs are willing to pay. And because they feel that you don't have a choice, so it's a constant battle. So I feel that we need to see how we manage the HMOs and health insurance. Because what I tell people, because I worked in this a long time, just look at the vaccine. People tell they've done vaccine, they've done service delivery, but they haven't done it because it's too expensive to provide. They'll just give you a record, but it's not done. So, on that note, let me stop. So thank you very much, sir.
Thank you.
Then, Dr. Tunji commended the organization's efforts in strategizing and executing such a great medical facility. He further provided actionable solutions to the proposed acts and challenges affecting the organization as put forward by the CEO, Dr. Abiola Olorode.
Let me congratulate you for this, for your effort and for your hard work. You could say your dad is your financier, but it's vision. People say success. There are two things about success: implementation, policy implementation. Success 10% policy, 90% implementation, and I'm saying that it's just circular. You could have vision, but actualizing vision is what matters the most. You had the vision, you didn't put out the work, they had the effort together in providing state-of-the-art healthcare system to our people. This is also, I see this as service to humanity as well. So thank you for doing this for our country. The setting this up is just the beginning of the work. It's actually to keep this to keep all the equipment here in the serviceable state where your downtime will be almost close to 0%. That's why I'm indirectly directing that to you, and in a way that the cost of your SLA service level agreement will be reasonable. So G, take note of that. So that's where the hard work is, and you also actually have to get value for the investment, because you need. There's no way you can provide. You can have this level of investment and not charge. The price will not be that low for them. Moving to the other thing you've said, looked at this kind of services you're providing here. Before I address your ask, I'd like to give you some advices here. And you and I have spoken about this before you opened this place. And I told you that one area that we should look into is ambulatory surgical services. We don't have that many kind of services like that here. Look at it now today, luckily Lagos State, and I wish as things goes on, this will expand to other states of the Federation. We're beginning to be withdrawing people from sub-Saharan Africa to come and do aesthetic surgery here. And the aesthetic surgery is one part that nobody wants to go to the hospital for that. It's ambulatory, come in, you go out. And also with the business model of ambulatory surgical services, it's even much lucrative because you don't have that. The nurses are there, they do the procedure by evening, everybody's gone, you're not keeping people overnight. So please look into that, and you can, in such a way that you can just open it up as a freelance will come in, they book time, surgeons will come, they book time, they leave. So look into that. Now you also have to develop synergies with other hospitals because you can't, the way you would have to get volume here is to have a robust marketing strategies. Well, and we've spoken about that using social media platform and things like that. And to the extent that you can even get people from other parts of the other countries in West Africa to come in and do their procedures. And you also have to look for people that have cheap hotel next day that people can come. You provide a form of a complete a la carte of services for them, including accommodation, they do their procedure and other things. You have CT scan, also diagnostic service, invasive diagnostic services like CT guided biopsy and things like that, mammogram, core biopsy and things like that. You should look into that because you don't want to. You also, the key, the biggest part you have is investment. You now have to leverage what are other people doing. 90% of people are doing CT scan, they're doing MRI, but then what are the other services that you could use this CT scan to do, CT guided biopsy, things like that. And as you do that as well, I'm not unmindful of the fact that the manpower is not here. You also need to leverage a diaspora population to see how people can come in to come and provide those level of advanced services here. So once you get to that level, you distinct Diamed as a specialized, not just a general diagnostic center, but more of a specialized center where people will now come. If you go to that place, you get this level of service there. Now, the other thing is that you also have to look into exploring and making this place as a training center. For several reasons, you help provide needed support in a drive to increase a human resource for health. You also will use that to create a flow of highly skilled manpower to yourself, but at a much cheaper rate. And there's several ways you could do that. You're not a full-fledged hospital that has pediatrics or OIG surgery, but then you can still affiliate with some of the hospitals for them to send their house officers to come here to do part of your residency training and in some of the things you offer here. But the bigger part is that you could actually use this as such to provide residency training in radiology and some other services that you offer. So if you want to, we're working on some hospital will set up interventional radiology fellowship now, fellowship now. We've been able to get about 3-4 hospitals to collate together to do that fellowship with National Postgraduate Medical College. But you could, your center could be part of general radiology services and things like that. So please look into that, and that you can affiliate with any hospital, note whatever hospital that you could, because you have all the equipment there. You also should look, as you were talking, with the level, with the volume and quantity of equipment that you have here. You also have to build a robust biomedical engineering services to support you, because you need to build that in-house capacity. And one of the things we've done is that we've joined to attest to this. We're working in a collaborative fashion with our four School of Biomedical Engineering, where GE and also JNCI has agreed to do some internship for them. You can and also you can roll this as part of the internship as well, George. You can because you have several things that you have CAT-scan, you have MRI, you have digital X-ray, you have mammogram, so things like that. You can also talk to her about that, and this will be a place where people can do come and do their internship. And as they do their internship, you can pick 1 or 2 or 3 that you like. That will be your resident biomedical engineers, because you have to do this in such a way that you're doing a long-term 5-10 year survival agreement with the original equipment manufacturers. It's going to cost you more money compared to building your own local team here. Then I said you beyond digital marketing, beyond social media platform marketing, you also need to have more physical people that will go out to market this. Because you can't just look at it, keep it as, okay, people walking. You need that extensive marketing strategy so that people would, you'll be a referral center to several hospitals around. So those are my suggestions for you, and I think these are pragmatic things you could get on quickly. And now, you want to respond to that then before?
Okay, so thank you very much, sir, and I'm always pleased to talk to you. You take a lot of insight and you don't rush when you give your comments. Let me start by saying some of the topics we're discussing, like the ambulatory surgery. And as I told people, and I've been telling people, that's minimally invasive surgery. Because I've been coming, you do your pre-op workup, come in fasting, you do your surgery, and then maximum 24 hours, you're back home. That's why we have very few days. That's something I've always preached. But when I tell people that when I opened up this place, I did it progressively. And from the least complicated to the more complicated, because as a new institution, what you don't want to do is to get a bad name. And I needed to make sure that my staff were gelling and things were moving. So definitely, the first thing we did was to do the radio imaging, open up the radio imaging, and then open up the lab, pharmacy, and then the consulting rooms. We're working on opening up the lab and the theatre this month. And next month, November, we have a team of the HFH, Hospital for Humanity, I doing a 2-week mission here, pediatric health surgery. So that's in the works. And the aesthetics, we've been talking to a woman, which is basically pediatric health surgery with the HFH, to do the sort of surgery. So those are things we're planning, but we're doing it step by step so that we don't make mistakes. Synergies, marketing. We started our marketing strategy, but the very first thing we did was to comb, this area of the smaller health facilities. But Nigerians are very difficult to collaborate with. They don't want to collaborate. Everybody wants to handle their patients. I tell them, I'm not interested in stealing your patients. So that's one thing that HFA needs to work. Even our co-colleague members, I don't want to name names. There's something on my street. He's been here, he sends one person there, it's a very good quality, but still won't send more patients. Tell us to bring referral forms, we drop it, so many, we don't see them. They don't want to collaborate, I don't know why. So it's difficult, so but we've explored that. The training center, definitely when the NNRB came to accreditors, they always also told us because of the level, and they've also expressed they will send some interns to us. So we've been working at that. We have a Diamed engineer grant, which I can say loudly. We have two biomedical coppers. So that's the tip. I know we have a lot of equipment and digital marketing and physical marketing. So we're expanding our scope of our marketers. We had a team of 2, but in the last 1 week we gave them. But all the sales are expensive. We have to gradually put things in place. But the thought is that the will is there. But I know that as we have more friends and family for Diamed, we'll also. So thank you. We've noted it and we're very interested and we're looking at it very well.
Thank you, Albi. And I'm going to ask, but let me add one more thing about people not wanting to collaborate, because I think you have to be very distinct, very distinctive in the way you market your services, because you want to, for you, you have, this is a full-fledged, like, you have a lot of services there, but the imaging part is what you should market more. Because if I have the hospital there, and somebody needs CAT scan, I don't have the CAT scan, they would have to come here. So there would not be any problem, but if my patient comes here, they won't come back to me. So I think you should just create your service line. The one you market, if you go market, you market as a hospital, have dialysis, have ICU, have this, they will run away. But your imaging part, even you go to any hospital, you work in America and in the US, in the UK, a hospital will be like this. We have outpatient diagnosis services within the hospital, but outside different entrance. People come in, and those are the outpatient diagnosis center is actually a huge money maker for any hospital system. But that doesn't matter. It doesn't matter. They still have their own, the other full-fledged medical healthcare services that they run. You should be able to just get people to come in, do their imaging, leave. If one patient, they go with patient here. And in Nigeria environment, what Mikio, that's what Mikio did for so long. And that's what they still do. So, because this is, I can imagine the money you spent on CT scan, it's heavy investment. You need high volume traffic to break even, to really break even.
So we just got a marketer, and she joined us on the 1st of October, and she's given us some areas on how to really bring up the images.
Yeah, so just market that mostly significantly. Because there's no mismatch. If you go to any hospital, these are services for MRI and things like that. And with the HMO as well, if they have patients in other hospitals that want to have go for diagnosis service, or go to Diamed for. So please be distinct about that. And with the collaboration with Dr. Adido, I can help you with a lot of opening contract with diaspora healthcare workers, where they can even come. A lot of them want to come and they want to come and give back, but then they've been used to working in a very highly structured, highly resourced environment. So this will be a place that they will come and comfortable. So we can now also provide some highly skilled workers.
No, I know how to do Dr. Directly and indirectly. Okay. I know what to send to you.
Now, with your ask as you were talking, you have to now look at what be more proactive into the future. And I was saying, okay, I didn't want to know you were going to ask about power. What the government is now doing, and with this level of investment, you should be able to do that. Setting up mini grids, because I was talking to the Minister of Power about 2 months ago. We look at our university system. The visa of last year, I was just convinced to me just a few days ago. My energy bill is 500 million.
Wow.
Wow, and this is it. But then government will work to support them. But what government is decided to do now is that for these universities and big hospitals, we'll set up a mini solar grid that will generate about 2 megawatts. So for a place like this, you should also look at that. To set up because at the end of the day, it will be much cost effective for you. You might have a huge frontal investment, but if you roll it at the way the money you're going to spend on band A, diesel and things like that, setting up those a mini solar grid, do your energy audit, probably about 1 megahertz here, you set it up. I don't know why it's taking us this long as a country, but we have a president that gets it now, that's looking at things more in totality. You go to Europe, you go to Denmark today, Denmark generates about, Sweden and Denmark generates about 7% of the energy from windmills. They're using your natural resources that God has given them. And we have sunlight, so look at into mini grid, and I'm lucky enough there are a lot of companies here that could set that up. So it's not just solar panel that they generate 24 kilowatts and things like that. They can build mini grids now. They fuel, I think there's several Chinese companies, lithium-based mini grids, 1 megahertz, 2 megahertz, 3 megahertz for you. So please look into that, because that's probably what you need to. I know you ask, but if I tell you now, government will work with subsidizing a private sector. We're still, President is giving some kind of commitment that the public hospitals will be subsidized at about 50%, but then it's still, every subsidy you do, you take away from government resources. And just yesterday, I was meeting with the president. It's still about this problem about our country is being this, and I'm going to digress a little bit here. We're a country that every part of our life have been so subsidized. It's all about subsidy. People did not know that. Everything, energy subsidy, petrol subsidy, everything will do. But the key part where we should subsidize as a country, we're not. Which is, what are those key parts? Things that lead to human capital development, growth of kids, when that will give them pathway to develop as a healthy children. Subsidized food, things like that, we're not subsidizing. You go to America, every subsidy on food, every. But that's how they won't subsidize things that ways of life. But in a country, that's what we've done. And no government has been able to just say, okay, let me begin to look at how we can put this country on the path of prosperity. Well, the subsidies are not, they're not sustainable. And now the citizens have gotten used to that. So when the government now came, we're not making enough money. Oil production had gone to crash to the lowest level, and we continue all the subsidy. So that's why everyone's looking at this president, this president is wicked. No, we can't even afford this. This country would have collapsed. So energy and electricity was almost subsidized by 90%. And by then this president came in, the past government had amassed almost ₦1 trillion in unpaid subsidies to the generating company. So, but then if we had done things the right way, invest in cleaner energy, solar, things like this, we won't be here today. And that's why we're also talking about CNG. If you're using generator as well, let me give you the advice, retrofit your generator to CNG today. And luckily here in Lagos, where you have access to CNG, you will be running those generators at 20% of the cost. Let's get out of this usual norm and look at how we can do things differently. So I can imagine you're paying about 1,200 naira per liter to do on diesel. If you retrofit your generator, that will cost you a very small amount of money. You'll be spending 20% of what you're spending on diesel today on CNG. And you have people who provide, you have people that vendors now that will just ship the CNG gas to you. So you can look into that as well.
Furthermore, the minister, as well as the media team on ground, including Eco Hot Blog, was led by the CEO, Dr. Abiola, on a brief facility tour exercise in and around the wards, X-ray and radiology rooms, therapy rooms, and other diagnostic labs littered across the floors of the 4-story building medical facility.
Yes, this is, we have an optometrist.
Okay, that comes now?
Yes, is there permanently?
Have you started seeing
well, that's when yes, we can do your eye test for us to do. So each area, we have Dr. Choma, all of our welcome, ma'am. This is all of our other doctors. This is
oh, how are you?
Good morning, sir. Dr. Diamed is a consultant family physician.
How are you? How's it going?
Yes, very well. Thank you. You can do a stress test here.
Oh, stress test, okay. You have how often does the cardiologist come in?
Cardiologist comes in usually on Mondays.
Mondays. One Larry was asking, what's your volume? How many patients are you seeing now?
Our volume has been about 10 to 15.
A day.
Not a day yet. In about a week. More procedure room.
Okay. Now this is procedure. Do you do endoscopy?
Well, we do endoscopy.
Okay.
So we have changing rooms. This is the 3D mammogram.
Yes, I can see this.
It's actually the latest mammogram we have now. It's called Pristina sonograph. And it's 3D because it gets images and slices. Unlike the normal mammogram we have in other facilities that is 2D, that just gets a cut CC and mm. So this has an edge compared to others. And it's not painful. Yes, it's not.
Yes, thank you.
So here we have the 64 slice.
This is for Jesus, right?
Yes, and it's automated. So it's suitable for pediatrics and emergency cases. And it has dose modulation. You know, we all have this perception about CT having high radiation. And it's a fast scan. So in less than a minute, you can have your brain scan.
64 slides. Do you have your dosimetry?
Yes, we do. We have the alpha.
That's right. Okay.
So this is a console room that starts with the seats and MRI.
Also bilateral console. Okay, both ways. This is good. I haven't seen it before. So, what two different directions? Okay.
That's MRI.
We do cardiac MRI. So it's an open MRI, but those people that are used to that are claustrophobic. So we also give them headsets to help them to listen to music and read the MRI stuff.
It's a bigger ball, so even bulky patients can fit in.
We had like this that couldn't fit in recently. Oh, that person was very big.
Yeah? Exactly. So the patient, but you can tell what
No, you can't.
you can do the way to build a grid, a minute mega grid. Okay, yeah, this
Taking X-ray images. So this one uses reduced amounts of radiation. It has automatic exposure control that helps to measure the patient body before exposing the patient to radiation. So it gets quality images.
It does 60 tests per hour and 25 parameters. We also have a coagulоmeter here, CL 412 for all coagulation studies. Let me take you to the storage area. We are setting that up.
And this is like the
So here, section is cut tissue to working sizes, and then processing follows after the cutting. And the slides are produced. Here is our slide mapping X3, the immunology platform. It does over 1,000 different analyses from
Snipe.
mapping X3.
Chinese.
Okay.
72 samples.
Is it like those things that the Roche has, the immuno?
Yes.
So let's go to the third floor.
What about ground floor? What's on ground floor?
One place just the reception, the pharmacy,
Okay.
the kitchen, the ER,
Okay.
and the staff area. So chairs. So we have a more complex things we invite.
How are you?
So that's our two dental chairs. That's
As I was telling you, don't change your business model. How many stations?
8.
8 stations?
Good afternoon, sir.
How are you? You're the
Nephrologist.
You're the what?
Dialysis nurse, yeah.
You're the dialysis nurse here. Okay. Where's your water room? Show me your water room. Which machine are you using? Presidios?
Yes, Presidios, yes, sir.
I'll see it. These are Presidios machine. 2001? 4.408. Where's your arrow?
Arrow is there.
This is the water. This is the brine type. Where's the let me see your arrow machine. Why do you separate it out? Open it. No, where's the brine? Where's the arrow?
The arrow is there. We have two rapid machine. Yeah.
So you find water from there to there?
Yes, sir.
Who designed this for you? You put your arrow here.
This one. Rapid machine. So this controls this. It also controls the other.
So this controls which one?
There are 5 machines here, so they are put working together, so they control the 8 machines. This controls 5, this controls 6. For these 3, or they work together.
This is. So the water comes from there.
From there, yes, sir.
And it comes through the wall.
So this is Mr. Diamed. I'm American engineer. I said we told you from which is a very experienced.
I'm very well, thank you very much,
So this is
sir.
post-op area.
Okay,
You should be ready by now.
What?
If I want it.
Yes. We took it back to Council because of storage. We bought this place, we started and demolished. So we took it back. Yes, so we took it back to them.
Sir, if I don't develop my equipment, I can't do this now.
There was also a meet and greet session shortly after the brief tour between the minister and the staff of Diamed Center Limited.
Nurses,
everybody let them introduce themselves.
introduce yourself.
Yeah, I'm Dr. Olusegun Peter. I'm the clinical director.
Okay,
Yeah. I'm Dr. Lazimiti, I'm the wellness director.
What?
The wellness director.
Joshua Esther, I2.
Public care.
Public health, what's that? Yeah, administrative director. Director of
Okay. I'm not the HR.
Akiloke, BGM.
Business development
manager.
I call it Bachelor of Plenty.
Dr. Walakai Fine,
I think I'm Susanna, videographer. The next thing I arrange the accountant. Olabisi Moss, a registered nurse.
Victor Emery, optometrist.
Onimuto Chukwu, lab scientist. Adekoyanisola, pharmacist. Henry Onomo, say nursing assistant.
Anthony Potter.
Then, dialysis.
Felix Timothy Potter. Kevin Darian, IT manager.
Diamed Tefia, nurse. Diamed Mobola, general technician.
Victoria, accountant.
Julius Carter, medical lab scientist.
So good afternoon, everybody.
I'm Kunle Adeyanju. I'm the facility manager and I'm also the biomedical engineer.
Good afternoon, everybody. I'm very happy to meet everyone and I'm very happy to meet them. You guys are everyone here, you're privileged to work in a state-of-the-art medical center. The kind of facilities that you have there is what you get anywhere in Western world or developed world. So I implore you to really be very meticulous in the way you handle all this equipment, and more importantly, you have to develop a high-level customer skills because this is not a government facility, it's a private facility. You have to treat the patient as the center of your work because you want them to come back here. Care for them the way you would like to be cared for. Dr. Lomede has made every investment in a place like this.
Then the minister had a group photograph with the staff members as he and his entourage concluded the visit. With all said and done, it is clear that the Nigerian healthcare sector is experiencing a new wave of development, and Lagos is championing the cause to change the unfriendly narratives about the state of health and social welfare in Nigeria. And hopefully, this trend will spread across all states of the Federation in no distant time. I am Daniel Samson Ido, reporting for Eco Hot Blog.
How to ensure that they get the best. So, congratulations everybody.
Thank you so much.
Let me talk, before I talk about the state of our health reform in the country, which is what I can talk about 24 hours a day. Let me first talk about why we're here today. I'm very happy to be here at Diamed Medical Center on the invitation of Dr. Lomede, who I have to commend as a very patriotic Nigerian for taking all our time, committing this huge investment to building this facility. Here, this facility compares to any facility in the world. We have all the state-of-the-art equipment that you could ever think about. 64-slice CT scanner, 1.5 Tesla MRI imager, and you also have one of the few 3D mammography machine in the country. You have digital X-ray. This facility also has 8-station dialysis unit, 3 well-equipped operating room. They have a nice dental suite, nice optometry suite, and they have very beautiful ward, 2 high dependency unit. They also have a pediatric area. This is a very, very good health facility, and with the level of investment here and the kind of services this health facility will render to our citizens of Lagos and citizens of Nigeria. This is what this government stands for. We understand the fact that as we reform our healthcare system, improve our healthcare services to meet what the President Bola Ahmed Tinubu has mandated us to do, that every single Nigerian gets meaningful and comprehensive healthcare. We're leveraging a relationship between the public and the private sector, and that's why we're here. The government is here to support the private sector for them to continue to thrive. Hospital like this, we've had meeting, I've had conversation with the founder of the hospital, Dr. Lomede, how she can further expand the capabilities of the hospital by doing training, using this as a center to train house officers, also as residents, and also other allied services personnel like radiographer. Even nursing can do their internship here. All in all, I'm very happy with what I've seen here. This is complementary to what we're doing as federal government. Now, to answer your question specifically about the state of healthcare in Nigeria, before President Bola Ahmed Tinubu came about 15 months ago, and where we're at today, we've made giant strides in our healthcare delivery system. Our federal tertiary hospitals are better funded. You go there now, the services have improved. You get any high-level primary, secondary, or tertiary care at the hospitals. As federal government, we're also collaborating more with the state, a subnational government. We're supporting them, helping them to improve capacity. We've also
aggressively increase the number of people who are training in the healthcare sector. We've increased our admission into medical school, dental school, medical laboratory science school, nursing school. Before we came in as a government, the country was enrolling just about 28,000 nurses annually to our nursing schools nationwide. Today, I'm happy to report that we're enrolling about 64,000 nurses annually now, and before the end of this year, we'll be enrolling 100,000 nurses. We've doubled admission to our medical school as well. Before we came in, we're only admitting about 5,000 medical students. Today, we're admitting over 10,000 medical students. Also, several things that the government, President Bola Ahmed Tinubu has done. You've heard about the education loan fund, which is available to our students. That's in area of human resource and capacity. I've spoken to you about how we're building infrastructures and how we're equipping hospitals to be able to deliver state-of-the-art healthcare services to our citizens. We've also, the president for the first time also signed an executive order to lower to remove exercise duties and VAT on medical on pharmaceutical equipment, drugs that are API, active pharmaceutical ingredients that are being used to make drugs in our country. The pharmaceutical industry is thriving, and also we're supporting we're working closely with the private sectors as well. We've enhanced our residency training. We now have specialties that we're not training before: interventional cardiology, interventional radiology, even hospice care. Our cancer care in the country is expansive now. We have the National Institute of Cancer Research and Treatment, which we're using as a focal point to manage our cancer program in the country, from screening, prevention, therapeutic intervention, and hospice care. So I can continue to talk, but our healthcare, our reform is working and is delivering better quality of care to our people. On the public health side, we've come up with a sector-wide programming approach. We're working with our development partners to align and coordinate our resources better. We're deploying more funds to our primary care centers. Today, we're going to expand. We're working on expanding the number of primary care centers that is offering comprehensive health care to our citizens across the country, from 8,000 to 70,000 primary care centers in the next 2 years. And these primary care centers will be more funded to improve infrastructures at those primary care centers, do more money for medical consumable drugs, and also more funds to recruit human resource healthcare workers. We're also training about 120,000 frontline healthcare workers. I think we've trained over 60,000 before the end of the year. We should be completed with training. We should be completed with training about 120,000 new healthcare workers in the country. So all in all, our reform is beginning to yield a lot of results for the country, and I have to particularly commend our president for this president believes passionately in improving the health care of the country, together with several other reforms that the president is doing in other areas of our economy. But let me just focus, I'll continue to focus on the healthcare sector. This 2024 budget, we have the highest budgetary allocation for healthcare in the history of our country. And this is a manifestation of the president's commitment to Nigerians. So, thank you.
This is what we call a multi-specialty hospital, and we try to, first we have a radio imaging section, and we have the 1.5 Tesla MRI. Apart from, there's also some other areas, functioning parts that you can use for some specialized cardiac and cranial MRI. We have a CT scan. We have a 64-slide CT scan. We have a digital X-ray. We have a 3D mammogram, one of the very few 3D mammograms in Lagos State, which is an advance from the 2D mammogram, which is the usual. We also have a CM. So we also have a lab where we do the hematology, biochemistry, immunology, and microbiology. an histopath. So we have a well-established, we have a pharmacy, we have a dialysis unit, as the minister said, the 8-bed dialysis unit. We have 2-chair dental, we have a physiotherapy, we have 8 beds, and we have theatres. So it's a multi-specialty hospital. What we're hoping to do is that we're hoping that people that want to come into the facility is a one-stop shop. So you can, because one of the things that used to discourage me if I had to go for a wellness check or to have to do some investigations, that I can't get a comprehensive checkup somewhere. I have to go to different multiple stops before I leave one facility to maybe go for something else. But here you can get everything done, and from your radio imaging to your laboratory to your eyes, we have optometry, to dental, to dialysis. And we also have, what we try to cater is that if you're here for the whole day, we have a very good kitchen. I have a very good chef that can cater to you, so you don't have to worry. So we can take care of you for the whole day, spend the whole day, comfortable environment. And what we also try to do, we've tried to segment the hospital, so each area has a nice waiting area. We've tried to make it more like a home away from home. So the ambience is very, because a lot of people are very scared to go to hospital, and there's a smell that people associate with hospitals. We try to make it more like a home, so you're more relaxed, and so that's the way we look at it. We also think that we're going past the stage that patients are in the hospital for a long time. In this day and age, we're looking for patients that will come in. We've done the workup of the patient. When I mean workup, all the investigations. They come in fasting. They do the surgery that same day. Within 24 to 36 hours or 48 hours, they're back in their house, and they've then followed up for dressing and all that. And there's a lot of minimal invasive surgery. So those are the things we're looking to promote. So that's a nutshell of what we're doing in Diamed.
The transformation has been very, very significant, and it's intentional. The President Bola Ahmed Tinubu, wants to revamp from ground up the facilities available, the manpower development, research and training for the medical systems in Nigeria, such that we can compare with any systems, any health systems anywhere in the region and in the world at large. So it's a good development, and we hope with all this sustainable policy that has been put in place, we should be able to stand with our heads high among all nations. We will do a lot of contribution, first-class service that we've seen anywhere in the first world or the developed society. It has the facility that matches any center in the West and in Europe. We've gone around and we've seen that there's been a lot of investment with a well-thought-out plan for future. And development is ready for any discerning partners to collaborate and then do first-class, new generation investigation procedures between MRI, 3D, mammogram that gives you state-of-the-art, doesn't spend time to take off, and you can get this at a reasonable price, I'm sure, because you are in Nigeria, and instead of traveling abroad to do this, this is the best place to come.
Well, I think that there's a need for improvement in our healthcare services, and that's why I'm very pleased to be at this launch of the Diamed Medical Center, which is a state-of-the-art hospital with an amazing, really high level of quality equipment and services provided. Well, what we are hoping is that we get a lot of traction. As you know, Nigeria is poised to become the medical tourism center for West Africa. What we need is we need our diasporan physicians and surgeons and other specialist medical personnel to come back to Nigeria and utilize places like this. A lot of people have said in the past that they'd love to come back to Nigeria, but they can't find places with the state-of-the-art equipment, the kind of equipment they're used to abroad. So this facility has that kind of equipment. So what I'd like to do is invite those of our diasporans who are out there to come back here and come and look around and see if this is the kind of place that they can come back to, and then I'd like to encourage them to come back and use this place and turn Nigeria into that place that we want it to be. This is one of the top quality facilities, and we now have several in Lagos State that can offer quality care. So we'd like to encourage them to come back.
Well, this is it's a brand new center. It's one of our flagship centers today. We have put here, some of the most advanced imaging equipment we have in the country. They have a 1.5 Tesla MRI, a 64-slice CT scan. They have a 3D mammo, and a very advanced echocardiography equipment, amongst other things that we have here. These equipment all feature our latest, software, artificial intelligence, right? Dose efficiency, exceptional image quality, patient comfort. We're very proud of what we've done here, and Diamed is certainly going to raise the standards of clinical excellence in the region. We expect that. I mean, look, what every clinician wants and what we promise every patient is, quality, right? Clinical excellence, quality, safety, and speed, right? That's the promise. And if you look at it in that light, we expect that we will raise the standards of excellence when it comes to diagnostic efficiency in a Diamed, right? So looking forward to the wonderful outcomes that this center will generate for patients around here.
Diamed Hospital is a purpose-built hospital dedicated to care for patients, both indigent patients and international community. And of course, our vision precisely, we aspire to deliver an unwavering patient-centered, trusted experience as a global leader in healthcare. And our mission, we are dedicated healthcare professionals, delivering compassionate, ethical, and cutting-edge service. And that's who we are. Like healthcare all over the world is, a sector that has a lot to offer, because the health of a nation is the wealth of that nation. So we try to actually improve the healthcare in Nigeria, and we have a lot to offer. We have medical imaging modalities, CT scan, MRI, 3D mammogram for patients that need to be checked on breast cancer. We have dedicated X-ray machines, digital radiographs, and many more. Our magnetic resonance imaging MRI is top-notch, 1.5 Tesla, Signal Explorer G. All our equipments are G new, and we are actually positioned to help in healthcare. We try to raise the bar in healthcare system.
It has been an enlightening and rewarding medical tour at Diamed Medical Center, Oniru, Lekki, Lagos State. Beyond reasonable doubt, you would agree with me that the healthcare facility in Lagos and Nigeria at large has experienced a massive turnaround. Please do not forget to follow us on all our social media platforms at Eco Alt Blog. I am Taiwo Ido, reporting for Eco Alt Blog.